Hello, my name is Dr. Daniel Goodfriend. Some people call me Daniel, Danny, Dr. G. Anything is fine with me. Thank you for checking out the website. I've been doing my 3-minute thing on mental health to try to be helpful on different topics. Today I want to talk about phobias and OCD, and specifically the treatment of exposure therapy. When we have phobias and OCD, the basics of the umbrella is anxiety disorders. And what we do is we do avoidance behavior. In phobias, we avoid whatever we are afraid of, like an elevator, for example. And in OCD, we do rituals and things that magically we think are going to take out the anxiety. So the treatment of choice is what we call exposure therapy. And what you do is that you try to pin down with a person a scale from 1 to 10 of different things that will create anxiety, and we expose them to those things until we get to the peak, which is the most anxiety provoking idea. So for example, if the fear is one of elevators, we first might just see a picture of an elevator, or we will imagine an elevator, and then we will go to a shopping mall and we will just press the button and open and close the elevator, but we don't get in the elevator. And we use the topic of, or the subject of SUDS, subjective units of distress. If it's under a 6, it goes from 0 to 10, then you ask the person, and where are you, at a 4 or a 5? If it's under a 5, you ask them, are you willing to go for the next step? And maybe you want to go in the elevator and out the elevator, in the elevator, and so forth, until they're ready, and then they might be ready to go to the first floor. And you don't go anywhere where the person is not ready to go. You are their ally. I'm your ally to work with the person for them to expose themselves. Because avoidance behavior, even though it helps for the moment, what it does, it limits your life. Avoidance behavior is the worst thing that you can do in general, like procrastination. It just makes the problem bigger. It's like you putting a Band-Aid in infected wound, or it's like carrying a thorn in your foot that you're afraid of taking out, and so you're always in pain. So avoidance behavior is just not healthy, and what people tend to do is ask for reassurance, which is asking people, is this okay? Is that okay? Is this clothing okay? And are you sure it's okay? And when people reassure, that's not healthy, because it just fumes the anxiety. So I encourage you to seek out help if you have any kind of anxiety, and we can create a scale for you and help you do the exposures. So there is help out there, and seek it, because you should be able to live your life fully and not limited by your anxiety. Thank you so much.
Great. That was very good. It went a little bit over 3 minutes.
It's fine. So, Papi, plan your next thing.